Hello, good evening everyone. My name is Kevin Cervantes, and today I'm going to be talking about the genetic disease called Leber's hereditary optic neuropathy, also known as LHON. My focus will be on the current clinical trials that are being conducted for a future possible cure. So getting right into it, throughout the history of time, doctors and scientists have found cures for many different types of illnesses. All this wouldn't have been done without clinical trials. Now, a clinical trial is a way for doctors and scientists to test different medicines and methods to find these cures. In order for a clinical trial to be done, it must be approved by the FDA, and the doctors and scientists must follow different sorts of regulations that the FDA sets for these trials. I'll be talking about what the LHON clinical trials are, how they're being conducted, and what it means for the future of the patients that are currently enrolled in these clinical trials. But before getting into that, let's talk about what LHON is. LHON is a genetic disease that causes legal blindness to the central part of a person's vision. As seen in the picture below, this is a person who sees 20/20 vision. Now, on the picture on the right, that's a person who has LHON, but it's a circle of blurriness. Some people refer to as a frosted glass type of view. So the peripheral vision is perfectly fine. I spoke to the coordinator of these clinical trials named Maria Massini on March 2nd, 2020 via telephone conference. She explained to me that she wants to stop and reverse the condition by doing a gene replacement. She wants the old gene to be replaced with a new gene. The trial is a double-blind study, so the doctor or the patient do not know which one is the eye that gets the injection. Following that, they only hope to restore some sight in the person's vision. Now, after talking about what this is about, let's talk about how it's being done. I spoke to Dr. Mark Moster, who is enrolled in the same trial, and he told me that the different steps in doing these trials. It's the injection phase where they have the gene in one eye and the placebo on the other. You have the electrocardiogram test where they stick some pads on a person's body to make sure the nerves do not have any sort of problems. You have the visual acuity test where the person reads a chart, the visual contrast test where they read the same chart but with different letters, and the letters are different bold sizes. You have the visual field test where a person looks at a machine and clicks a button to say that they saw a light on the machine. You have the eye pressure to make sure that there's no fluctuation in the person's eye. The blood work to make sure that the gene is flowing through the person's body. The OCT scan, as shown in the bottom picture, to take a picture of the back of the eye and look at the nerve to make sure that it doesn't change colors or that there's no change at all. And just to look at the back of the eye to make sure that there's no other problems happening back there. So what does this mean for future patients and current patients in this trial? There are patients who currently restored some eyesight, other patients who got full eyesight back to where now they see 20/20. What does this mean for the future in general? Hopefully they do find a cure for diseases such as Parkinson's disease and that it gets released to the public. So recapping everything that we talked about, what this condition is, how it's being run, and the future for patients enrolled in the trial. People are only optimistic in this clinical trial, and seen in the picture below, I currently am a patient in the trial, and I and others that are currently enrolled only hope that we do restore some eyesight for ourselves. Here's my works cited. Thank you.